National City.
I'm like, damn, why do you want to go to Jollibee all the time?
I don't think we have a,
Okay.
do you have a pen?
Yeah, I always come through there.
Yeah, go and sign in, guys.
Oh, of course you have a pen. That's my pen.
Yeah.
Oh,
That's
it's
my
not. I
pen.
stole it from my daughter.
Why does it have
Okay.
my name on the side?
We're gonna go ahead and start. We're gonna
Okay.
start. Okay, this is our first in-service here in RCFE, and today is what, June 15th.
15th.
It's a Wednesday, and we're gonna talk about our mitigation plan. We're gonna talk about how to don and doff PPE. We're also gonna talk about hand hygiene, how important it is when there is an infection, and then how to clean things as far as the high touch areas when we have an outbreak. And so, just real quick, we're going to talk about hand hygiene because that's the most important part of trying to decrease the spread of infection. Obviously, there's a lot of studies out there when it comes to hand hygiene, how important it is, how to decrease the spread. That's one way to really decrease the spread is to increase your hand hygiene. Okay, and the first and most important thing about hand hygiene is the soap and water, and that friction and that soap, and for at least 12 to 15 seconds is what's going to help you remove those viruses and bacteria in your finger. And so when you're doing hand hygiene, you make sure you're scrubbing in between your fingernails and between your hand and that friction is actually what's removing viruses and bacteria. You're not killing these viruses and bacteria, you're actually removing them by way of friction and also lukewarm water and the soap. Okay, so that's one way to really think about hand hygiene as far as soap and water. The other hand hygiene that we're doing is it's called ABH or something like that, alcohol-based hand sanitizer. Okay, and with that you gotta to keep the alcohol in your hand for at least 20 seconds because that alcohol is actually gonna be the one trying to kill the viruses. Okay, that's when you have the bursting and of the viruses and bacteria when the alcohol. But you gotta keep your hands saturated and wet for at least 20 seconds. Don't dry them off in your hands because then you're not really fully killing these viruses. Okay. So now that we're kind of understanding how hand hygiene works, there is studies out there in the skilled nursing unit with outbreaks. They took skilled nursing units with outbreaks and counted who did more hand hygiene. The ones that did more hand hygiene had less time frame as far as infection goes. The skilled nursing with outbreak that did less hand hygiene, they had outbreaks longer. Okay, so break the chain by washing your hands. The other thing I want to talk about is the use of sanitation as far as killing viruses on the surfaces. Because when you have an outbreak, guys, you want to try to kill off these viruses and bacteria that's in the high touch areas, handrails, bed rails, the doorknobs. You want to wipe them down. If you don't have housekeeping in there, you're gonna have to do it yourself. Okay, if you look at this right here, germicidal, this is a bleach type. Okay, it's got all these viruses and bacteria, including COVID in here. Okay, that means it will kill all these viruses and bacteria. And on the other side of that, it should have kill time. Okay, there is kill time in here. Where is it at? Right here, kill time, 3 minutes for C. diff. That means that the surface of that counter has to be wet for at least 3 minutes. If you're going in there and just drying it off within 1 minute of it, guess what? You're not killing these viruses. And that's possibly why you're having all these spreads still, is because when you're wiping down counters, you're drying it off with a cloth. Okay, don't dry it off, keep it wet, and just leave it, let it air dry. Okay, but look at your kill time, take a look at your viruses that's on here, and then here's kill time right here, 3 minutes. Okay, you gotta read the boxes because it does have those information on there. Okay, very important when you have an outbreak is to wash your hands, and also obviously try to do your environmental cleaning services as often as you can, at least once a shift, so that way you're breaking the chain. Breaking the chain is the most important thing. Obviously vaccination is important, but when it comes down to outbreak, it's already too late for vaccination. Okay, we need to break the chain, and the best way to do that is washing your hands, cleaning services, and also donning and doffing the right PPE. So today I'm going to demonstrate how to really don and doff the PPE the right way. And so I'm going to have actually Crystal over here. We're going to put an example where we have COVID, right? COVID is droplet. But in our unit, we're using N95 for droplets. Okay, this is just for COVID. And so we're going to demonstrate how to put on the full PPE with COVID-related infection, and then when they use the N95. So when you're done your clothing, all your equipment, The first thing you would do, and all this information right here is gonna be right here. It's gonna be right here. How to don and doff PPE. Okay, before you get into residence room, obviously you want to wash your hands. The first thing you would do is you would put in these gowns. Okay, and Krista's gonna go ahead and put on these gowns. Here's a gown right here, and she's gonna put these gowns on. This is the first thing you would do. Okay, put a gown on first, and this information right here tells you, as far as paper goes, that the gown goes in first. Okay, gown first. Before you get in the patient's room, if you have somebody who's in airborne, you want to close their door, right? As far as, but if you have COVID, of course, 6 feet apart is what we want to do. But if you can close the door safely on the resident with COVID, you try to do that because you want to increase circulation in the room and then ventilation. So she's got her gowns on. The second thing we need to do is you want to put your face mask on, your N95. In this case, because we have COVID, we're gonna try to put on the N95. This is gonna get you a new N95 here, okay? And I'm gonna have Crystal over here put on the N95, okay? So you're gonna take the, like this, right? And you take the bottom part and you put the bottom part first and then the top, okay? So she's gonna put that in.
Yeah, that's the bottom. Yeah, you got it.
There you go.
You got it.
So underneath your ear.
Under my
Yeah,
ear?
there you go.
This one too?
Yeah.
Under the ear?
Yeah, under the ear. And then the second one should be the top of your ear. Try to keep that in place. Okay. She's got the N95. See the camera, I can see you here. The second thing you should do with your N95 that you got that in place is to make sure that it's really on there. You want to push that down right there. Okay. And then you want to do a test on it. Okay. A fit test on there. You want to push this down. And then you want to inhale. To make sure that all the air, there's no air coming in, okay? To make sure that's like nice and tight right there, right? Okay, so that's a type of testing you're doing. And then the other test you want to do is like a positive negative type of test, is you want to breathe out. If you're breathing out and there shouldn't be any air coming out on the side over here. If that's the case, if you have air coming in and out on the side right here, it's too loose and you want to try to get something smaller, okay? If that's adequate and that's fitted and that's correct, then the next thing you would do is put the extra stuff that you need to put on as far as droplet goes. What goes on with droplet? As far as your face shield, right? So you're gonna put on your face shield, and Crystal over here has a nice face shield that she's gonna put on, and that'll cover her face just in case. Remember, if you're closer to this patient, 6 feet and closer, you're gonna have droplet particles. It's hopefully preventing that from entering her eyes, and it's catching it in the face shield right here. Okay, the last thing you would do is you put on your gloves, right? And of course, Crystal over here is gonna put on the gloves, and that's a large gloves, and she's gonna put that on. Remember, 1 in every 10 gloves has a hole in it. I always tell people that. So when you're dealing with respiratory stuff or anything that has to deal with anything wet and moist and stuff like that, you want to put on gloves and you want to wash your hands right away. Okay, if you're doing bowel movement, if you're doing breathing treatment, anything that's mucosal membranes, make sure that you are washing your hands right afterward. Okay. Now, when sometimes we go into a room and we deal with mucosal membranes, we take everything off and then we just put this alcohol on. Okay, that's not really adequate when it comes to COVID. You wash your hands. Okay, like if you're not dealing with mucosal membranes, use your alcohol. There's no limit on how often you can use the alcohol-based hand sanitizer. There's no limit. You can use it 100 times a day. Except when you start dealing with mucosal membranes, you gotta wash your hands right away. Okay, if you have anything dirt or anything that's thick in your hands, of course you want to wash that. You want to wash your hands with soap and water. Okay. The next thing we would do is to doff these equipment off, this PPE off. Okay. So right now, the first thing we'll do is obviously the dirtiest to the cleanest. Okay. The dirtiest first is if you could just look at the camera as you're taking these PPE off. She's gonna take off the glove first. Okay. Without really contaminating her hand. Okay. And she's gonna show you how to do that correctly. There you go. And that's exactly how you do it. And getting it all over me now. I got all these mucus on me now. All right, so now she's got that off.
You're gonna take a shower now,
Yeah.
man.
Okay, so the next thing she would take off is the face shield. There you go. It's the face shield. Okay. And then if you forget, there's always information right here. Okay, in the back also. You're taking off the face shield. And then the next thing she would take off is obviously this gown right here. And there's a way to do that. And she's going to show you how to do that. Now, the clean part of the gown is going to be in the back.
Yeah.
You don't want to be touching
Yeah.
anything up front
Right.
because if somebody was coughing and sneezing, you got everything up front. And so also you can touch these little strings and you can just pull that off just like that. There you go. You see she knows it. All right.
Yeah.
There you go.
You had to do it.
You got it down pat. And then you can pull, you can touch the inside now because it's nice
not
and
that
clean.
tight, yeah.
And so now she can get rid of this dirty PPE.
Trash.
And then so she throws it on me now. All right. So that's how you do it. The N95, we're not done yet.
I forgot.
The N95, you want to keep on until you leave the room or you're 6 feet away from the resident. You should have been removing all this stuff a little further away from the resident anyway. If there's a curtain there, you can pull the curtain. But with this right here, even if you got to go out, there should be a trash can outside the door. If not, if you're 6 feet apart from the resident, you can safely remove these N95s. If you are in an airborne isolation type of room, for example, somebody has TV, you want to close the door and remove this outside the door. But because it's COVID, it's droplet, 6 feet apart from the resident, you can safely remove this mask. We still want you to take it off though outside the door. Okay, so take off your N95. Remember that the strings in the back are clean. Those are what we can touch and remove. And she's doing that the right way. There you go. And you throw it away. This is a one-time use type of N95, disposable, and you get rid of it. And that's how you really try to remove this PPE when you're in isolation or you have somebody in isolation. Okay. So,
All right.
any questions on how to apply PPE though? How to put on PPE? Yes, ma'am.
This is, no?
Yeah, that is
wanted
that's
to
an
bring this
N95
up.
as well. Yeah, that's an N95. Just long as it says here
N95.
NIOSH.
This is what I'm talking about.
That's not good right there. Okay,
That's
so
why I'm.
so what she's showing is that these these strings right here, people are actually playing around with it and cutting it and removing it. What happens is that it's no longer an N95 and effective if it's loose on you. Okay, if you cut it and make it wider, if you have an infection in the unit, you want to make that as tight as you can. You don't want any air coming in and out. Okay, especially when you're doing transfer, hugging the resident. If that's not tight on you, you haven't been infected in the last 3 months, you're likely to get that infection. Okay, so keep your N95 nice and tight. It'll keep you safe from these viruses. 'Cause remember, you got to go home too and protect your family, right? So keep those N95 nice and tight, and keep your mucosal membrane covered, which is your eyes and your mouth, obviously. All right, so let's go over admissions real quick. Let's go over admissions. When you have new admits, RCFE, you really, the best practice, you should probably test that resident before, even if let's say you have a resident coming back, they've been at the hospital for about 5 days, they're coming back, you want to test that resident. If you have a positive, of course you want to isolate right away. But right now, the PIN right now is asking that we test the residents coming back from admissions, okay? So I just kind of want to touch off on that as far as admission goes. Let's go over our infection control process here. When we have a positive resident, okay, all right. So let me go over this real quick as far as contact precaution. When we have somebody who has COVID, that patient is gonna be on contact precaution. Contact means that if you're touching the resident, you gotta have some form of protection. So that means you gotta have gloves and you gotta have gowns as far as contact goes. Now droplet, this patient is gonna be on, who has COVID is gonna be on droplet and contact. You're gonna have this sign right here. And then I have another one that says contact, the yellow one. Where'd he go? In any case, here right here. So when you have, I have this cart here. I'm gonna show everybody here the cart. But if somebody has COVID, they're gonna be on contact precaution, and also we're gonna have this sign that says droplet precaution. That means that when it comes to staff coming in, you're gonna have gowns and gloves, and then face shield, and then an N95 is recommended with COVID. But for droplet, specifically droplet, you can use a surgical. But for COVID, droplet means you still gotta wear N95 is what is recommended. Okay, so you have contact, you have airborne, you have droplet precaution as far as patients who might be in contact isolation. So let's go over our our mitigation plan. Let me just show everybody real quick as far as what this cart looks like. But that's what the cart looks like as far as isolation cart, and that's what we're gonna leave in RCFE. This is the same thing as in Goldberg as far as the type of cart that we have. So I want to go over the if somebody if we have as a unit have a positive staff but no positive resident, I just want to kind of review that all your activities and stuff like that is still communal dining. We continue to do that. Activities, outings, all that stuff remains the same. We can safely wear a surgical mask. If any staff feels like we are unsafe, I want to wear N95, you're more than welcome to do that. Okay, the time when we start putting on N95 is when we have a positive resident, because that's an outbreak type of situation when you have a positive resident. Positive staff, no positive resident. We test the same way if you're exposed, but you can continue all your activities, and all your masking is going to be relaxed a little bit, with no positive resident. But as soon as you have a positive resident, you want to decrease movement. Now, can you have activities when you have a positive resident?
Yes.
You can still have activities, but you got to be very careful. And then it
There's
really
a limit.
depends on. I'm
There's
sorry.
a limit. There's a limit.
You want to limit, yeah. You want to try to spread the residents around. Don't get in big activities. Also, managers in each department can make their own guidance to make sure that the residents in the unit are all safe. So if you want to be more restrictive because we have a positive resident, we can be more restrictive, obviously, to try to keep the residents safe, right? But communal dining can still happen. Like I said, if you have a positive resident, it really depends on your manager as well. If you feel that there's too many residents though that are being infected, we can all together kind of slow down these communal dining. But this piece of paper right here that we made out, it should be available in the offices. It goes over what we need to do when we have a positive resident, and then, or if you have a positive staff but no positive resident. And but it kind of goes over. I don't know if you've seen it.
Yeah, I think we do have.
Very
Yeah.
helpful, yeah.
Yeah.
Okay.
I posted
Alright.
it.
Yeah, we do have some in our
Yeah.
hub.
If you're fully vaccinated and there's no positive resident, and then on your staff you were exposed, then we recommend that you test on the second day of exposure. If you remain asymptomatic, you test on the second day, you test on the 5th day, and then you also want to test on the 9th and the 12th day if you're exposed. Okay, that's just a 14-day type of thing. We're trying to make sure that you're not infected after the 10th day or 14th day.
So it's a 14th day, not the 12th.
Well, 14-day total. When you want to clear the 14th day, but you want to test on the 12th day, so that way you're
12th
negative.
day. Oh,
Yeah.
I'm sorry.
Yeah.
Yes. Okay.
So you do
Got it.
test 2, 5th, 9th, and the 12th.
Got it.
Yeah. So, but 14-day total testing. So just, and then with the cases rising, it seems like we're doing a really good job. If the only infection we're getting is staff, it's not.
Yeah.
You know what I mean? Because all this infection could be happening from outside the building. Because if it was happening here, you'd be infecting your resident. Okay, so the masking and your infection control process is actually working in the building if you're preventing the resident from getting infected, because the resident are not masking, but yet they're not getting infected. Okay, so keep testing the way is recommended when you're exposed. Now, if you have a positive resident, and everybody's fully vaccinated, basically, any resident that's around that resident is gonna do the same testing. You're gonna test on the 5th day, and the 2nd and the 5th, and then and so on, 9th and 12th, until we can get it these negatives up to 14 days. Okay. So, but anybody who's symptomatic, obviously you want to test right away. You want to test these residents or staff right away as far as symptoms go. Okay. So this should be available. This is pretty easy to follow. If Cynthia's not available, David's not available,
Yeah,
we're like,
but
man, what do
posted.
we need to do?
Yeah.
You see it in there, right?
Follow these right here.
It's in the.
Yeah.
It's in the hub.
Yeah, and just go ahead and man, what do we need to do? What's the activities like? What's the masking gonna be? It should tell you on that sheet of paper what you need to do. If survey comes in, like the health department comes in and they ask, hey, what you guys are doing? What's the plan? It's like, well, the RIP or infection prevention has said that this is our plan or whatever, and this is what we need to do. Just show them this, and if there's question, obviously you can call me, call Cynthia, call David. and then we'll explain to him, you know, where these information are coming from. You know, but all the information are coming from obviously from the pins. I made a copy of the example of the pin right there. It talks about admission. It talks about visitation. So but there's new updated pins all the time. Okay. So I'll be doing some in-service once a month here in the RCFE, and hopefully, if you guys got questions or concerns, you can bring it up. We can have more in-services. If things are a little confusing, we can clear that up. Okay. So it's usually, you know, these in-services should be nice and quick, but to the point, you know, so that way you guys can move on with your days, right? All right. So is there anything that you think that I missed, or should we cover? What are some of the things that you guys are concerned about? That's specific to your department.
Do they still have to pay you, or you have to use your vacation?
If you have COVID, if you test COVID, it's a really good question. As far as COVID, if you test COVID and you've already used, if you haven't tested COVID since January, you get 40 hours.
Oh.
You get a total of 80 hours, but the rest of the 40 hours goes towards testing, waiting, if you have symptoms, vaccination. If you want to get vaccinated, you can get a day off and get paid COVID. Okay, but you only get paid 40 hours if you test positive for COVID, only one time this year. So if you test 2 times already, like I did, I have to use PTO. You're gonna have to use PTO, unfortunately. Okay, so.
Do you understand that?
Yeah.
Really?
Yeah.
Cynthia make me worry.
Yes,
Yeah,
because
yeah.
the only
No, you're asymptomatic, you come to work.
Yeah,
yeah, you don't have any symptoms. Cynthia, you have to come and work.
yeah. So if you are fully vaccinated, you've been exposed, you can't. There's no restriction of you saying. There's no rules that say you have to stay home. If you've been exposed and you're asymptomatic, if you're fully vaccinated and you're testing negative or whatever, you come to work. You test on the second day, the 5th day, you continue to work. Okay. The same thing, guys. The most important thing right now is if you're taking care of somebody who's positive. This is it hasn't come out on the pin yet, but they recommend that you test every day until. For example, if I'm positive and my mom's taking care of me, she's gonna test for 3 days until I get off my quarantine. Isolation was 10 days, and then she's gonna test 7 more days on top of that. So every 3 days she's testing. That's not something that's seen in the pin yet, but that's something that, as far as CDC goes, that's what they're talking about. So.
I'm not isolated.
Family
when
members
I
taking
have.
care.
I wear masks to sleep. I wear masks to sleep.
You wear masks to sleep.
Yeah.
Why is that?
Because when I test
You're
with
positive, then you're positive.
but I'm asymptomatic,
Yeah.
you know, I come to work, but I wear mask. Everything I do, I wear
No,
mask.
you
if I'm
better
going to sleep.
isolate, man, rather than.
Yeah. Just isolate in your room.
You never know.
Yeah. Okay, some good questions. Any other questions?
Especially when you have, like
go
me, my mom is old, it's gonna be easier.
Yeah. Okay, perfect. Make sure you
All
sign
right.
this, guys. You get your CEUs and.
Alright,
we'll,
thank you. Thank you,
everybody
thank
sign all
you.
this?
Yeah, we did.
All right,
So
perfect.
you're going to have like in-service every month?
Yeah, I'm gonna have in-service every month. I do have in-service and skilled nursing once a week. If you guys want to join that, you're more than welcome to do that.
Because they're gonna ask us, the state's gonna ask us, you know, if
Yeah.
you've been in service, and
Yeah,
we'll say
that is
yes.
right. That is true.
That's very
Alright,
true.
thank you. Thank you.
Leonard,
Thank
don't
you.
forget your